The goal for every new patient who comes into the UCLA Breast program with a new diagnosis of breast cancer is really to help them through this otherwise daunting journey, and we give them a really great outcome at the end. We've really pulled together top quality, fellowship-trained breast surgeons whose sole purpose is to take care of patients with breast disease. That's all we do, day in, day out. As surgeons, we have a responsibility to not only successfully treat the breast cancer, but to try to maintain a patient's quality of life as much as possible. Whenever a patient calls in for the very first time, they're connected right away with our nurse navigator. The nurse navigator helps the patient get all of the pertinent records that they need, helps the patient get their first appointment with either the breast surgeon or with the multi-team, and then we'll come up with a personalized treatment plan for that patient. So it starts with a breast surgeon, but treatment of breast cancer is not based on one physician at all. We have amazing reconstructive surgeons. We have our plastic surgeons who are fellowship trained in microvascular surgery. We have amazing medical oncologists who lead clinical trials that change the outcome of patients with breast cancer. We have amazing radiation oncologists who have at their disposal all of the newest technology in terms of how we deliver radiation. But treatment of breast cancer involves treatment of the whole person, not just the breast. We have psychosocial counselors, we have nutritionists, we have acupuncturists, we have a whole team that is available to treat the whole person. The best thing is when the patient has their cancer removed, they go home and sleep in their own bed at night. So it's about an hour and a half surgery. They spend about an hour or two in the recovery room. They go home without very much pain afterwards, and it's not a difficult way to recover. We also are teaming up breast surgeons with medical oncologists throughout the entire Los Angeles community, really. So the idea is to bring the high quality care that a patient gets at UCLA closer to a patient's home in these separate areas. If we can in any way make that whole process less stressful for a patient and make a patient leave their appointment feeling like they're going to be well cared for, and I think that's the best thing that we could hope to do.